Orthopedics. The field of orthopedics was first developed to treat children who had crippling or debilitating diseases. It makes sense, then, that the word orthopedic is derived from the Greek words ortho, meaning straight, and pais, meaning children or pediatric. Today, orthopedic physicians treat patients of all ages. What is an orthopedist? An orthopedist, also known as an orthopedic surgeon, is a medical doctor who specializes in the diagnosis, treatment, and prevention of musculoskeletal conditions and injuries. The musculoskeletal system includes bones, joints, muscles, ligaments, tendons, and other structures that support the body's movement and function. Orthopedists are trained to treat a wide range of conditions, from common issues like fractures, sprains, and strains to more complex problems such as joint diseases, spinal disorders, congenital deformities, and trauma-related injuries. They use both surgical and non-surgical methods to address these issues, with the goal of relieving pain, restoring function, and improving the patient's quality of life. Orthopedic surgeons undergo extensive medical education, including medical school and residency training, focused specifically on orthopedics. They may choose to further specialize in specific areas within orthopedics, such as sports medicine, pediatric orthopedics, joint replacement surgery, spine surgery, or trauma surgery. In addition to treating patients, orthopedists often work closely with other healthcare professionals, such as physical therapists, occupational therapists, and pain management specialists, to provide comprehensive care for their patients' musculoskeletal needs. What is an orthopedic physician? Are they different from surgeons? Orthopedic physicians can choose to focus on either surgical or non-surgical treatments, depending on their training and expertise. Here's a breakdown of the key differences between orthopedic physicians and orthopedic surgeons. Orthopedic physicians. Orthopedic physicians have completed medical school and a residency in orthopedic medicine. They are trained to diagnose and treat musculoskeletal conditions using a variety of methods, including physical examinations, imaging studies, and non-surgical interventions. They provide non-surgical treatments such as medications, physical therapy, injections, and other conservative therapies to manage musculoskeletal issues. Orthopedic physicians may specialize in areas such as sports medicine, rheumatology, pain management, and non-operative orthopedics. They collaborate with other healthcare professionals to provide comprehensive care and help patients explore all available treatment options before considering surgery. Orthopedic surgeons. Orthopedic surgeons have completed medical school, a residency in orthopedic surgery, and often additional fellowship training in a specific orthopedic subspecialty. They are skilled in performing surgical procedures to treat various musculoskeletal conditions, including fractures, joint replacements, spinal surgeries, and more complex orthopedic procedures. Orthopedic surgeons often specialize in specific areas such as hand surgery, foot and ankle surgery, pediatric orthopedics, or trauma surgery. While surgery is a significant part of their practice, they may also provide non-surgical treatments when appropriate. Orthopedic surgeons work closely with patients to determine the best treatment plan, whether surgical or non-surgical, based on the patient's condition and goals. In summary, both orthopedic physicians and orthopedic surgeons are integral parts of the musculoskeletal healthcare field. While orthopedic physicians focus on diagnosing and treating a wide range of musculoskeletal conditions using non-surgical methods, orthopedic surgeons specialize in surgical interventions for more complex cases. The choice between seeking care from an orthopedic physician or an orthopedic surgeon depends on the nature of the condition and the treatment approach that best suits the patient's needs. What are musculoskeletal issues? Musculoskeletal issues refer to a wide range of conditions and problems that affect the muscles, bones, joints, ligaments, tendons, and other structures that make up the musculoskeletal system. This system provides the body with structure, support, and the ability to move. Musculoskeletal issues can encompass a variety of symptoms and conditions, ranging from minor discomfort to severe pain and dysfunction. Some common examples of musculoskeletal issues include 1. Fractures and bone injuries. Broken bones or fractures can result from trauma, falls, accidents, or repetitive stress. They can range from simple hairline fractures to complex fractures that require surgical intervention. 2. Arthritis. Arthritis is a group of conditions characterized by inflammation and degeneration of the joints. Osteoarthritis and rheumatoid arthritis are two common types that cause pain, stiffness, and reduced joint mobility. 3. Back and neck pain. Conditions such as herniated discs, spinal stenosis, and sciatica can cause pain, numbness, and weakness in the back and neck areas. 4. Muscle strains and sprains. Strains involve the stretching or tearing of muscles, while sprains affect ligaments. These injuries can result from overexertion, lifting heavy objects, or sudden movements. 5. Tendinitis. Tendinitis is the inflammation of tendons, which are fibrous tissues connecting muscles to bones. It can occur due to overuse or repetitive movements. 6. Bursitis. Bursitis is inflammation of the bursae, small fluid-filled sacs that cushion and reduce friction between bones, tendons, and muscles. 7. Sports injuries. Athletes are prone to injuries such as ligament tears, example, ACL tears, muscle strains, and stress fractures due to the demands of their activities. 8. Carpal tunnel syndrome. This condition involves compression of the median nerve in the wrist, leading to symptoms like pain, numbness, and weakness in the hand and fingers. 9. Scoliosis. Scoliosis is an abnormal curvature of the spine that can develop during growth. It may require monitoring or treatment, depending on its severity. 10. Torn ligaments. Ligaments are tough bands of tissue that connect bones to each other. Tears in ligaments, such as the anterior cruciate ligament, ACL, in the knee, can lead to instability and reduced joint function. 11. Degenerative disc disease. This condition involves the breakdown of the intervertebral discs in the spine, leading to pain, stiffness, and reduced flexibility. 12. Joint dislocations. Dislocations occur when the bones in a joint are forced out of their normal positions, often causing intense pain and immobility. These are just a few examples of the many musculoskeletal issues that individuals may experience. Proper diagnosis and treatment by medical professionals, such as orthopedists, can help manage these conditions and improve quality of life. Treatment approaches may include medications, physical therapy, surgery, lifestyle modifications, and other interventions tailored to the specific issue and its severity. What does an orthopedist treat? Orthopedists, also known as orthopedic surgeons, are medical doctors who specialize in the diagnosis, treatment, and prevention of a wide range of musculoskeletal conditions and injuries. They are trained to address issues affecting the bones, joints, muscles, ligaments, tendons, and other structures that make up the musculoskeletal system. Some of the conditions and injuries that orthopedists commonly treat include 1. Fractures and trauma. Orthopedists treat broken bones and other traumatic injuries, often performing surgical procedures to realign and stabilize fractured bones. 2. Arthritis. Different forms of arthritis, such as osteoarthritis and rheumatoid arthritis, can lead to joint pain, swelling, and decreased mobility. Orthopedists offer both surgical and non-surgical interventions to manage arthritis symptoms. 3. Joint pain. Orthopedists diagnose and treat joint pain caused by various factors, including injury, inflammation, overuse, and degeneration. 4. Back and neck pain. Orthopedists address spine-related issues such as herniated discs, spinal stenosis, sciatica, and other conditions that cause back and neck pain. 5. Sports injuries. Athletes with injuries like ligament tears, example, ACL tears, muscle strains, stress fractures, and joint instability seek orthopedic care to regain function and return to their sport. 6. Muscle and tendon injuries. Orthopedists treat muscle strains, tears, and tendinitis, which can result from overuse, trauma, or repetitive movements. 7. Ligament injuries. Injuries to ligaments, such as torn ACLs or MCLs, are common among athletes and require specialized orthopedic treatment. 8. Degenerative disc disease. This condition involves the gradual breakdown of spinal discs, leading to pain, stiffness, and reduced mobility. 9. Carpal tunnel syndrome. Orthopedists treat nerve compression conditions like carpal tunnel syndrome, which causes pain, numbness, and weakness in the hand and fingers. 10. Scoliosis and spinal deformities. Orthopedists evaluate and manage spinal deformities, including scoliosis, kyphosis, and lordosis. 11. Pediatric orthopedics. Orthopedists who specialize in pediatric care treat conditions affecting children's musculoskeletal systems, such as congenital deformities and growth-related issues. 12. Joint replacement surgery. Orthopedic surgeons perform joint replacement surgeries, such as hip and knee replacements, to relieve pain and restore function in severely damaged joints. 13. Foot and ankle issues. Orthopedists treat conditions like bunions, plantar fasciitis, Achilles tendon injuries, and other foot and ankle problems. 14. Hand and wrist conditions. Orthopedic care includes addressing conditions like carpal tunnel syndrome, trigger finger, and other hand and wrist injuries. 15. Tumors and bone disorders. Orthopedists diagnose and treat bone tumors, bone infections, and rare congenital bone disorders. These are just a few examples of the diverse range of conditions and injuries that orthopedists are trained to manage. Orthopedists use a combination of medical, surgical, and rehabilitative approaches to provide individualized care and help patients regain function, reduce pain, and improve their overall quality of life.